Okay, we ready? Okay. Good afternoon, everybody. My name is Peter Zanoni. I'm Corpus Christi City Manager, and we're going to begin our press briefing for today, May 6th. This is a joint Nueces County, City of Corpus Christi press briefing on COVID-19. We do these every day at 5 o'clock. And today is myself speaking, and our Public Health Director, Annette Rodriguez, will speak after I speak. Tomorrow, which is Thursday, our elected officials will be here, so Mayor Joe McComb and Nueces County Judge Barbara Canales will be joining us tomorrow. Today, we'll talk to you about our COVID statistics. We do an update every day on the number of COVID cases and other related statistics to COVID-19. I'm going to do a quick update on two of the city's pools, given the governor's order from yesterday. And then we're going to give two thank yous and recognitions. And then I'll turn it over to Annette, who's going to talk about our upcoming drive-through collection site tomorrow. It'll be in Bishop tomorrow. But at the former Memorial Hospital parking lot, there'll be a testing site there as well. And tomorrow, performing the test there will be the National Guard. They've been in Nueces County since Sunday or Monday, and they've tested, this will be the third test event of the week. And then Annette will also talk about those tips that we need to follow to stay healthy and keep COVID-19 away from yourself. And we need to remind ourselves of those constantly. And so she'll talk to us about those as well. So that's the itinerary for today. We appreciate those that are watching on Facebook and YouTube, and some of our network channels that covers this live as well, and our Caller Times paper is here as well. So we appreciate the people watching. The numbers still continue to be pretty consistent with a high viewership, which shows that the community cares, and the more we talk about this, and the more you, the watching community, inform your colleagues, friends, neighbors, the more we can stay in a pretty decent situation in terms of number of COVID cases in our community. So let's begin with the statistics. Every day at 4 o'clock, we look back at the past 24 hours to see the number of COVID cases that we may have picked up in that past 24 hours. We also look at persons that are in the hospital and the recovery rate. And so since yesterday at 4 o'clock, we've picked up 3 new cases of COVID-19. You can see our graph is kind of, it has on average about close to 3, I think, is what our Corpus Christi group we're talking about today. You can see going back 7 days, we had 3, 4, 1, 0 on Sunday, but a big number on Monday, 1 yesterday, and 3 new cases today. So in total for Nueces County, since we've been tracking this, there's been a total of 117 confirmed COVID-19 cases. But of that amount, and I'll show you a graph in a little bit, we only have 41 active cases, right? So 117 total, but 41 active, and the difference of persons in recovery. We track deaths, and so far in our county, we have 3 deaths in Nueces County. 2 are Corpus Christians, although 1 was actually working for the past 2 months in Nevada, and then a third one is from Robstown in terms of our deaths. The distribution between male and female is pretty consistent today with the 3 new cases, 2 being male and 1 being female. We have a total of 52% or 61 male persons that have had or have COVID, and then 48% or 56 females that either have or have had COVID-19. We, for the community, show an age distribution of those 117 cases to show the community how it falls in the age demographic. And the key message we say every day is that age doesn't really matter. There's a COVID case in every age bracket with the exception of the 90-plus year, 90 or older bracket. There's a pretty consistent distribution when you look at the age group of 20 to 79. And there's 3 in the age bracket of 0 to 19 years of age, and we have 1 in the 80 to 89 year bracket. But between 20 and 79, there's 20 to 25 or so persons in each of those age categories. We report to the community tests performed, and this means tests that are analyzed in a lab. It's a 2-part testing number or a process. There's a test taken, say at a drive-through site or at a private physician's office or at a hospital. That's part one, or step one of the test. But the second part is to analyze the specimen, they call it, the swab that they take from the nasal passage, to test that in a scientific way to see is it a positive case or not. And so those are the numbers that we report of the tests ordered or performed. And today, we between the city-county testing facility and then the commercial labs that do testing, and a total of 120 new tests were conducted today. So our running total is 3,310 tests that have been performed in our community, which is getting close to that 1% if you think about the total population in Nueces County. These numbers do exclude the National Guard testing that has happened, so there's been some pretty decent numbers through 2 National Guard testing sites. We're going to work with them to get their information to make sure if they can show us which persons just lived in Nueces County. But nonetheless, we'll begin to add those in as well. I think by tomorrow, we're going to show a graph also that shows how are we doing week over week with tests, because our testing numbers are up with all the different agencies that are testing. And with our testing at the Memorial drive-through, with the number of persons that we're bringing through that drive-through increasing, the number of tests being analyzed is up. But we're going to show you that tomorrow in a week over week or weeks over week graph to help you understand. Okay, and then we like to show, as I mentioned earlier, that people are recovering. And so while we have 117 active cases, when you exclude the 3 deaths and then you look at who has recovered and not recovered, 73 persons, or 64%, we got to go back one graph, have recovered. There we go. So you can see more persons have recovered than that are still with the virus. 41 persons of the 114, when you exclude the 3 persons that have passed away, are still with the virus. They're still not past their period of still having it. And so this is a good sign, though, because we have more recovered. We still have 41 active cases and then those 3 deaths. In terms of persons that are in the hospital, that number increased from yesterday. We had 4 in the hospital yesterday. Today, with an additional 1 person being admitted, we have a total of 5 persons in the hospital. And of that number, 2 are in intensive care, and then the remaining 3 are in regular care recovering. And then when we look at where these persons live within Nueces County, the majority live in the city of Corpus Christi. All 3 cases that are new from today are from the city of Corpus Christi, so there's 99 persons to date that have had or have COVID that are in Corpus Christi. 2 are from Robstown, 7 are from Port Aransas, 7 are from rural Nueces County, and then we have 1 from Agua Dulce and 1 from Bishop, and that takes us to that 117. Okay, so those are the statistics. I think we're gonna do a translation in Spanish, and then we'll continue on.
En las últimas 24 horas se han reportado 3 nuevos casos por el coronavirus. Actualmente en el condado de Nueces existen 117 casos confirmados. Entre esos, 61 son varones, 56 son mujeres. La mayoría se encuentran en el rango de edades de entre 30 y 39 años. En total se han llevado a cabo 3,310 pruebas entre hospitales y el Distrito de Salud Pública. De los 117 casos, 99 son residentes de la ciudad de Corpus Christi, 2 son residentes de Robstown, 7 son residentes de Port Aransas, 7 son residentes de áreas rurales, 1 de Agua Dulce y otro de Bishop. 73 de los 117 se han recuperado por completo, haciendo así un total de 64%. 31 han sido hospitalizados, 5 continúan en el hospital y 2 en condición crítica en la unidad de cuidados intensivos. 41 casos continúan activos y se han reportado hasta la fecha 3 fallecimientos.
Okay, great. Thank you. Okay, I'm going to move on to 2 other quick updates. And in the beginning, I should have noted, because I know some people are interested in this, some of the outlets have called this media outlets. But Annette will also cover, and we'll be here for questions after, 2 areas that have become of interest for the community. That includes STX Beef. So it's a beef processing plant that we have in Corpus Christi. We're going to talk about a COVID case there, as well as what we've been doing to help the operators. And they've done a great job in increasing cleanliness of the facility, also doing temperature checks, We've been there helping them, offering advice. We had a nurse there yesterday. But Annette will talk about that processing plant and the situation there. And then nursing homes is another area across the country that is of concern. And that's going to bring us up to date on a breaking story from last night where an employee recently was tested, or yesterday was tested for positive COVID-19. And we'll talk about how we're managing that. In both cases, our public health district has the jurisdiction and the responsibility for public health. That's the main function of their district. And so there's some oversight powers that we have. And our biggest job, though, is to make sure people stay safe, whether they're working in the facility or in the case of the nursing home, they're being cared for or living there. And so we have a duty and a responsibility to help and assist, and there's some powers that we have as well. If we have to use those, we can. And so we take all these situations very seriously, and we'll update the community on this today. That's part of what Annette will do. Okay, so one thing to update on, and I'll have more information tomorrow, is on our 2 swimming pools that are customarily open at this time of year, which includes our natatorium and our Collier swimming pool. They have been closed because of the COVID situation, the goal to minimize groups and social distancing. We closed those when we minimized staff reporting to work and implemented a lot of telecommuting over the past couple of weeks. But the governor yesterday allowed public pools to reopen with certain guidelines to include a 25% limitation in terms of number of persons that utilize the pools. So we want to let the community know, because we know there's a great group that likes to use both the natatorium and the Collier pool that we're working on today, and we should have tomorrow. And I'll talk about it at tomorrow's press briefing, and we'll probably release it ahead of the press briefing. But we're going to talk about the reopening of those 2 facilities, that being the Collier pool and the natatorium pool. The natatorium is primarily used for lap swimming, and so there'll be some type of procedures, probably a call-in procedure to reserve time for a particular lane for a particular amount of time to do lap swimming. Collier pool, there's lap swimming, but there's also a little bit more free swimming. There's a elderly group that uses the pool at certain times in the morning. And so we're developing the protocol and the rules and the time and that type of thing. And we'll hopefully have that ready for tomorrow, as well as the opening date for both of those pools. The city has numerous pools across the city that we typically don't open until that Memorial Day weekend. And we're working on what that would look like as well. That's later in May. But right now we can open up the natatorium and the Collier pool, and we'll have more information on that tomorrow. And then just 2 or 3 thank yous here from my part, and then I'll turn it over to Annette. So we want to, I don't know if people are aware, but today is National Nurses Day, and we want to give a big shout out and a big thank you to all the nurses that are out there. They're part of our critical public safety teams, first responder teams, and they've done a tremendous job. The country certainly has thanked them better than what I'm going to do here at this press briefing, but we just want to recognize them locally. In the city of Corpus Christi, we have a lot of great nurses that have put their lives and families aside to care for patients that may or may have thought they've had COVID-19, plus all the other stuff that we deal with or they deal with on a regular basis. So we appreciate the nurses, and we wanted to say that today during National Nurses Day. And then we want to thank 2 individuals that have fed city employees. That's something that the community has done a great job at stepping up and feeding various departments. I know the health department has received a lot of meals over the last couple of weeks from restaurants or private donations from folks. Here at City Hall for this week, we've had 2 people that we want to recognize. Margarita Fertella fed the city manager's office on Tuesday. And today, Kimberly Stockseth has a group where she and some of her friends, a circle of friends, just decided amongst themselves to pool their money and feed various city departments as many times as they could. And they have a partnership with Water Street Restaurant. And so today we got lunch at the city manager's office. There was also plenty for the city attorney, some of our communication staff and our IT staff. They had 25 meals from Water Street Restaurant here downtown. The food was excellent, as it has been in the past couple of times that they provided us lunch. So we want to thank them, Kimberly Stockseth in particular, and her group that has funded these meals. It's a great thing to get, especially when our teams, like here at City Hall, work pretty much around the clock on COVID. So thank you, and thank you, Margarita, as well. Okay, so with that, I'm going to turn it over to Annette, who's going to do a couple of updates, and then Annette and I will be here to answer any questions that you might have.
En resumen, en cuanto a las albercas que son usadas normalmente para prácticas como son el natatorio y Collier, el día de ayer, como parte de la orden del gobernador, se incluyó la reapertura de esas albercas para el 8 de mayo. Y para la reapertura de las albercas públicas para uso en general también lo anunciaremos en una fecha posterior. El día de hoy es el Día de los Enfermeros y Enfermeras y le queremos agradecer a todos los que han hecho todo lo que han hecho durante este tiempo de pandemia. En cuanto a las albercas, quiero que sepa que el público que estamos trabajando en el desarrollo de protocolos para reabrir esas albercas para su uso por entrenamiento. El día de mañana vamos a tener más información sobre el uso de las albercas. Y como tema final, antes de que comience la directora del Distrito de Salud, el gerente de la ciudad indicó que le quiere agradecer a aquellas personas que han traído alimentos gratuitos para algunos empleados del ayuntamiento, entre ellos el restaurante Water Street y Margareta Frátila.
Thank you. Good afternoon. Annette Rodriguez, Health Director. The National Guard is operating the collection sites in Nueces County, Aransas, and San Patricio County this week. There will also be one in Bishop. The Health Department will be out in Bishop tomorrow, and that'll be starting promptly at 8 a.m. in the morning. And we're going to be at the park in Bishop, Texas. As announced yesterday by Governor Abbott, there will be more businesses reopening at limited capacity and with certain restrictions. Again, as mentioned previously, it is highly recommended that each business come up with their own unique plan while still adhering to the governor's guidelines. This will help to ensure the safety of their customer as well as their own safety. Some of these businesses will require individuals to be in close proximity to each other, such as barbershops and hair and nail salons and others. We encourage individuals that go to these businesses to wear a mask to keep from spreading germs. We also ask the barber and the hairstylist to wear a mask as well, but we realize that wearing a mask all day long can be difficult. So taking breaks in a quiet, secluded space should be a part of their plan. Individuals should ensure the guidelines for reopening their businesses are followed and seek to add additional precautions and creative measures to avoid transmission of the virus. Social distancing in all businesses is a must. You must have at least 6 feet distance between customers, whether they're inside your business or outside. Everyone outside your family members must abide by the 6-foot distancing requirement. We are receiving a lot of questions about nursing homes, our meat processing plants, and other congregate settings. What I can tell you is that all of these places are of the utmost importance to us. We have seen the horrific things that can happen in congregate settings with the COVID-19 very quickly. So we are paying extra attention to these places that have a lot of people working together or have extremely vulnerable populations. If we have positives in any of these types of facilities, we quickly isolate the case. We start contact tracing to monitor those that come in contact to the positive. These facilities are all doing their due diligence to keep these environments clean, to social distance people, and to institute other mitigating strategies to keep employees and residents safe from COVID-19. We recently had a healthcare worker who tested positive that had been at some of these long-term care facilities. They had traveled out of the country and come back, and they had quarantined themselves for 14 days. After the 14 days, they returned back to their facility to work. A few weeks later, they went to get tested, and they came back positive for COVID-19. They did not have symptoms. Still, this individual had visited the nursing facilities. So we reached out to the facilities, and we talked to them about the things that they needed to do, like isolate any resident that they had come in contact with, and to make sure that all of the staff that had come in contact with the positive were also distanced from other people, were wearing their protective personal equipment as needed. We also realized that on day 24, which was April the 24th, was the last time the individual had come in contact with a resident. So if you look at 2 weeks from that time, that would be this Friday. So this Friday would be the last day that we would be monitoring to see if anybody actually became positive in the facility. At this time, we have no positive residents in the long-term care facilities. Again, I want to repeat that. We have no positive COVID-19 cases of residents in the long-term care facilities. Still, the rapid response team was activated, and we are testing at these facilities. Again, we're testing in an abundance of caution and also to facilitate the process in the event we need the rapid response team activated in the future very quickly. It is important to remember this is not business as usual. There will be a lot of changes, but while the threat of COVID-19 still exists, we must understand this is our new normal. Everyone needs to be aware of their surroundings and take every precaution possible to stay safe and healthy. If not for yourself, do it for someone you love. Continue to stay home as much as possible, especially those vulnerable populations that we've talked about. If you are even mildly ill, stay at home. Do not go to work. Do not say, I just have allergies. Don't go to work. Stay home. This is not the time to come to work if you are sick. Only when you are completely recovered. As always, continue to do your part to stay healthy and stay informed. Thank you.
En resumen, la Guardia Nacional está operando sitios de recolección en el condado de Nueces, Aranzas y San Patricio en esta semana. Para hacer una cita, llame al número 512-883-2400 o visite la dirección txcovidtest.org. Como lo anunció ayer el gobernador Abbott, habrá más empresas que reabrirán a capacidad limitada y con ciertas restricciones. Le recomendamos a los dueños de negocios el contar con un plan para garantizar la seguridad de sus clientes, así como la de los suyos, adhiriéndose a las pautas establecidas por el gobierno. Algunos de estos negocios requerirán que las personas estén muy cerca unas de otras, como las peluquerías, los salones de belleza y cuidado de uñas, entre otros. Seguimos recomendando que si va a acudir a uno de estos negocios, utilice un cubrebocas al igual que a los empleados de estos negocios. En cuanto a los centros para ancianos y las plantas procesadoras de carne, estamos muy pendientes si hay casos positivos. Estaremos rastreando a las personas con las que estuvieron en contacto. Recientemente, uno de esos empleados de un asilo para ancianos resultó positivo al virus, pero hemos tomado todas las medidas necesarias para minimizar el contacto con personas que no están enfermas. Hasta la fecha, no contamos con ningún residente de ese centro que cuente con el virus. Continúe en casa tanto como sea posible, especialmente aquellas poblaciones vulnerables. Aunque se encuentre levemente enfermo, quédese en casa. No vaya al trabajo enfermo. Vuelva a trabajar solo cuando esté completamente recuperado. Como siempre, continúe haciendo su parte para mantenerse saludable y manténgase informado.
Okay, great. Thank you, Gabby, for that translation. Okay, just two more quick comments, and then we'll see if there's any questions. One is tomorrow is Thursday, so tomorrow Mayor Joe McComb and Nueces County Judge Barbara Canales will be here to add to the conversation that we have with the community. Myself and Annette will be as well, and we'll provide more information. And then on Friday, we'll have Annette and myself, but we'll also have our team here from Texas A&M University of Corpus Christi. Tomorrow will be their fourth presentation to the community. And what they're doing for us is modeling COVID cases in our coastal Bend region. They're also showing us how folks are interacting with each other more, getting out more, and what impact that could have. They have sophisticated models that most persons use across the country or world, but they use local information to help populate the modeling for us here. So those are informative briefings Friday at 5 o'clock. They also put their presentation on their website at Texas A&M Corpus Christi, and the city, I believe, has a link as well to theirs, or we put their PowerPoint presentation up. So you can watch it here live on Friday, but then you can also digest it a little slower going back to their website or our website. It's been great information for us as persons working the COVID-19 situation, but the policymakers, to include the mayor and council and Nueces County Commissioners Court, using that data as well to help make judgment calls on what to do locally to help minimize the spread of COVID-19. So that concludes our briefing for today. Annette Rodriguez and I are here to answer any questions that you might have.
Hello. These are more specific to the plant and to the nursing home employees. So is that more Annette or you?
Annette probably would.
Okay. So for the STX plant, how many employees have tested positive? Do you know?
We have a handful of people that have actually tested positive, and we're actually have reached out to all of their contacts to make sure that they know what they need to do. I will say that when you have a critical infrastructure, such as a meat processing plant, so normally when you have a positive, all of those people that come in contact with them, we take them out of the mix for 14 days to self-isolate or quarantine. That's not the case when you have an essential infrastructure like this. So they can actually work as long as they're asymptomatic, as long as they're wearing their protective gear. And so they have masks, and they have goggles, and they have face shields as well. So that's different than what the norm.
And when you say a handful, can you put a number to it?
I think 3 or 4.
Okay.
So.
And this work is very like close encounter. You're in a much more confined space. Do you know how close the person was to their coworkers?
You know, they don't seem like they're that close at this time. So there is a distance between them. So, and one of them, a really far distance. So we really believe that's more community acquired. The other ones that are inside the building, they're a little closer, but they're still distanced from each other. So.
And do you know what their role was, the first positive case? Like what exactly they did in the plant?
I don't know exactly what they do. I just know that they work in there, you know, with the meat, processing the meat.
Okay. And now for the healthcare worker that tested positive kind
Sure.
of questions. Do we know when they got their test results back?
Yes. Well, we actually got the positive on Monday, May the 4th.
And do you know if it was a private lab or through the city?
I want to say through a private lab, but I don't remember off the top of my head.
Okay. And do you happen to know what company they were contracted with?
I think there were several facilities, you know, here locally, so I'm not going to say specifically because I don't want, you know, any one of those to, you know, for the media to kind of be out there.
Sure.
So,
Okay. So you were notified the same day as the test results came back, correct? So both were
well,
full?
yes.
Okay.
As soon as the test results came back, we were notified that day.
Okay. I think that's all I have. Thank you.
You're welcome.
Hope you can hear me, but do family members need to, they're aware, I'm sure, and do they need to get those family members tested?
Family members actually, you're talking about for the nursing facilities?
Yes.
So family members actually aren't allowed into the facilities, so no, they would not need to be tested. The family members come into play because the nursing facilities reach out to the family members that actually sign as kind of their caretaker. So they reach out to them to ask them if they want for their resident to actually have a test.
Yes, that's what I meant. Any residents, have they gotten tested on those results?
We do have a facility, so what actually occurred was that we reached out to the state to kind of tell them exactly what happened, that we had an individual that was asymptomatic. And so the state said that because the governor had recently activated what they call the rapid assessment team, that they could actually come out and test. And so they were planning on coming out if the facility was wanting them or needing them. They have no positives, and that individual is taken out of the mix at this point. So we talked to the state, and the state asked if there was a way that the health district could actually go and do some of the tests for the facilities that were interested in getting tested. So we said, yes, we have enough ETM, we have enough of the testing kits that we need for the lab to analyze. And so we said yes, and so they actually tested this afternoon. I want to say close to 103 staff members were tested. For the residents, one of the facilities wanted to actually limit the number of people that come in to test their residents. And so what the facility did was they had their own nursing staff that actually worked there. They had them test their residents. So that limits more people coming in, the more possibility of possible exposure from, any potential breaks in donning or doffing. And so they had their own staff come in and test the residents, and then we will get those test specimens because it's our VTM, and we'll analyze the test for them.
How many different nursing homes were involved?
I want to say at least 3, and I think the individual was actually applying at another facility, and that's actually why the test was actually requested. Before they would actually put them on staff, they said they had to have a COVID-19 test. So they were tested even though they didn't have any symptoms, so.
Do you know where that individual is now? Is he still working, or?
No, the individual's actually now, since they took the test, now we did the another 14-day of quarantine. And so that's why we're saying this Friday will be 28 days that the person now has gone into quarantine, so.
Going back to STX beef, what's the time frame on that situation as far as
You mean from
quarantine?
first case?
The first case, and how long do they have for quarantine?
Well, the quarantine period stays the same, and it's for the COVID-19 positive, there's not a set 14 days. I don't remember the first case, the exact date. We're up to 117 cases, so I don't remember the exact first day. But what happens is when they're sick, they have to be taken out, and so there's not a 14-day. The 14 days for the contacts to the positive. So these individuals, until they're no longer sick, and they've actually are 3 days fever-free without any type of fever-reducing medication, and they've been in quarantine at least 10 days, then they can actually go back to work. But until that time, they can't go back to work. So, thank you.
Okay, do we have any more questions at this time? Okay, great. So that concludes our press briefing for today. Excuse me, for today. We appreciate everybody watching, tuning in. We appreciate the questions from the media. And we'll be here tomorrow again, along with myself, Annette, County Judge Barbara Canales, and then Mayor McComb as well. We'll see you tomorrow. Thank you.